James, thanks for your basic introduction into ProSage Heat.
Thanks, Perry. It's great to be here.
James, as you know, Performance Health is creating formulas and education tools to help the therapist learn more, heal more, and achieve more. And on that premise, can you share with our audience what orthopedic massage is?
Sure, Perry. Orthopedic massage is an advanced discipline within the field of medical massage. What we try to do is utilize a multidisciplinary approach to assessment, treatment, and specific client home care. What that allows patients is we use various disciplines such as functional assessment to determine the exact underlying condition. We use myofascial release, neuromuscular therapy, things like PNF stretching, strengthening protocols. And what this does is this optimizes performance in athletes. This reduces and prevents injuries in all of our clients. And we basically restore structural balance to the entire body for pain-free movement and optimal performance.
James, how does ProSage Heat enhance your work?
Perry, ProSage Heat to me was a godsend. For many years looking for the right ointment or the right lotion or the right oil, I found that the glide, the effectiveness of the glide to allow for specific and detailed myofascial work, for more effective trigger point therapy, to get me deeper, faster, melting my way into the connective tissue was very important to me. And what this does is it lets me in deeper, faster. Its heating element in itself reduces the ischemia causing trigger points and neuromuscular patterning and allows me more effective therapeutic results. So I think that this is the ultimate product for me to enhance every technique I do on every patient I see.
Even though you're going to demonstrate primarily ProSage Heat, can you share with our viewers how BioFreeze fits into your home patient care program?
Perry, BioFreeze to me is critical home care. I find that the patients go back to repetitive motions and poor postures and activities that sometimes create this muscular imbalance, this structural imbalance. The BioFreeze is an easily applied self-application to reduce any residual inflammation, to break pain spasm cycles, to reduce inflammation in the joints. And I find that every patient can then maintain their therapy between sessions. It's also a passive source of income, so I always have it in my practice. The patients love it. They can't be without it. Many of my patients will say it's the only thing that keeps me out of pain between sessions. But I think the combination of the ProSage Heat to treat the cause of the underlying symptoms combined with BioFreeze is the perfect solution for total pain-free movement.
James, we're looking forward to the demonstration. Please wow us.
Thanks, Perry. Hello again. I'm here to treat carpal tunnel syndrome and tendon pain of the elbow. One of the things I just want to remind you is you always have to start by doing pelvic stabilization and at a minimum work on muscles like the sternocleidomastoid, the pec minor, the scalenes, things like that that can cause nerve pain in the neck and shoulder. With that said, I'm going to go ahead and work on the forearm and wrist component of carpal tunnel syndrome and tendon pain of the elbow. One of the things about the ProSage is it's going to allow me the perfect glide. It's also going to allow me to warm the tissue. And in this case, not only am I going to activate it with some palmar friction, but I'm going to apply it with a little bit of palmar friction to heat up the tissue of the forearm. What that does is that gives me deeper, faster access to all the muscles of the flexors that are causing the symptoms of the elbow and the wrist. One of the things you'll see if we close in on the camera is that we'll see a hyperemia, flushing of tissue after each and every stroke. And this hyperemia in itself is a rapid expansion of the fascia to allow an increase of blood flow. The heat melts the fascia like gelatin would be melted if you heated it up. That connective tissue release from the effects of ProSage and the ingredients of ProSage will allow me to speed up the process to get deeper into the tissues. You can see as I start gliding through the flexors that I've heated up the connective tissue. Had I gone this deep and this fast without the use of the ProSage, they would be feeling a lot of pain and a lot of tenderness with these deep strokes. The other thing is that the median nerve gets entrapped in here under the pronator teres. If I just pump a little blood in there, along with the effectiveness of the ProSage, I can press through the flexors without discomfort and allow the radius and the ulna to free up the pressure on the median nerve, to massage the pronator teres from the inside out. And if I go to stretch that muscle because it's causing median nerve entrapment, that would be an easy thing because of the heating elements going on, again, from the effects of ProSage. Go ahead and turn your palm down gently and relax, and then turn it up and we'll stretch. That releases both some of the tendon symptom here at the attachments of the pronator teres, and it also releases some of the increases blood flow into the tissues, further relaxing the tendons down here in the wrist. So I'm going to have you take a look at the tendons of the wrist, and as I get into that area, you can see that I can deeply get in between that. These are sheathed tendons. So as I go between these sheathed tendons, my goal here is to get the fascia that clumps these tendons together to sort of melt apart, which is another effect of the ProSage. I'm getting deeper between these tendons. Had I tried this without a heating ointment, I would not be able to do that. The other thing is I work into the hand. I'm able to open up the retinaculum. That's fascia again, and melting my way into the tissue. I'm going to give a gentle stretch of those muscles. When I go to stretch the muscles, he'll contract against resistance. Go ahead. Fatiguing the muscles so that I'll get a bit of relaxation. And when he relaxes and I give a gentle stretch, he'll extend back, reducing the tendon pain of the attachments here on the flexors, reducing the tendon pain, as you can see here. I'm melting my way into the hand and wrist. There's the carpal tunnel. You can see a great release of that tissue in there. And then when I come back into the hands, one of the benefits, and this is one of the reasons I originally approached Perry, is that if I can open up joint space, if I can take the hand and create joint space right here in the tunnel, I can allow for potential for spontaneous alignment of the carpal bones. If a carpal bone's out of position and I have no space in the joint, I wouldn't be able to do that. Again, the heating element. You can see the blood flow, the increase in blood flow in that joint. So I'll stretch that one more time. Gently flex against my resistance. 1, 2, 3, 4, 5, relax. And I'm going to traction the joint, and as you extend, I'm going to open that tissue up. A lot of my clients have degenerative arthritis in the hands, and one of the things that these tendons coming from the forearm feed the fingers, and they compress each and every joint. So once again, the myofascial response, the perfect glide, the increase of vascular flow allows me to move these bones within the hand. It allows me to traction each and every joint and start to free up degeneration of the cartilage, which is called degenerative arthritis. So as I start to traction each and every joint, before I go into a stretch, I can reduce some of the symptoms called degenerative arthritis. So I'll stretch that again. Go ahead and flex gently against my resistance. 1, 2, 3, 4, 5, relax, and then extend back, traction the joint. If I had inflammation in the joint, and I'm going to talk about this later on in this treatment, I would put BioFreeze in there. Joint inflammation is important to treat with BioFreeze. The last part of this treatment is that the flexors were worked on first, because when we're working on computers, when we're doing massage, we're using those a lot more. And the extensors usually get overstretched and weak. So I'm going to change the direction of the myofascial spreading. Again, I don't feel enough warmth, so I'm just going to apply maybe one more drop of the ProSage, heating it up to utilize the active ingredients. Warm up the tissue just a little bit and then do myofascial spreading again. Time is limited sometimes in our treatment, so I have to make sure I use the active ingredients to my benefit. And if I apply a little compression. When I go to stretch the extensors, if he pulls back gently, go ahead and pull back. And he finds a spot that's injured, that would actually be a form of tendinitis. If there's a strain in the muscle tendon unit, most people know that in the chronic phase, we would do a little bit of multi-directional frictioning, followed by resist just a little bit as I flex. Sometimes I'll just say flex gently, or I'll do a passive flexion. And as he resisted, I'll realign some of the fibers. If the inflammation continues, that would be the appropriate time to use the BioFreeze to the area, even post-treatment or at home. The last thing I'm going to show you is to utilize movement of the carpal bones. In my condition, I had carpal tunnel and thoracic outlet syndrome, combination of the two, and my carpal bone was out of alignment, so I'm going to show you a very, very short technique. Just make 3 complete circles with your hand complete open, 3 complete circles with the hand. And then go the other way. You feel the popping in the wrist. Following that, what I do is I just traction the wrist. I go into a gentle flexion. I press down on the carpal bones with traction and extension. And if spontaneous alignment does happen with radial and ulnar deviation, that allows for alignment of the bones in the wrist. So what I've done effectively is use the ProSage heat to melt the connective tissue, the muscles of the flexors and the pronators that cause the tendon symptoms both in the wrist and the elbow. Now, when the client goes home, it's really critical that they stretch these muscles, so I would show them stretches for the muscle groups involved. And more importantly, I would tell them, if you need to, at times, apply the BioFreeze to any areas of joint inflammation or repetitive areas of muscle strain, because that's going to allow you to be pain-free until you see me again. And our hopes is that the combination of the ProSage heating up the cause of the symptoms in the joints, and the BioFreeze treating the symptoms like inflammation and joint degeneration, is the perfect match for pain-free movement. Thanks for listening.